Kia ora. My name is Jean Hay-Smith. I'm from the Rehabilitation Teaching and Research Unit, the Te Whare Whakamatutu at the University of Otago in Wellington. We're a postgraduate, distance-taught rehabilitation unit, so we provide rehabilitation education where, when and how you need it. So essentially, many of your patients and clients want their care better, sooner and more convenient, and so do you. So one of the things that we undertake to do when you study with us is we undertake to widen the scope of your skills to help you transform your practice. Think about practice innovations, think about evidence-basing your practice, and thinking about extending your ways of thinking and your clinical reasoning. We intend to connect you with practitioners, clinicians and experts, often researchers from all fields of rehabilitation. And you can start study with us in semester 1 or 2 of any year. We're distance taught, which means you can get your learning done whenever you want it and whenever it suits you. And typically many of our students are part-time or full-time workers in healthcare, and so they are doing their study often in weekends and in evenings. When you study with us, our vision is that you belong with us. You're part of a connected, a collaborative, interprofessional group with a really strong rehabilitation identity. We're also really keen that what you learn with us is relevant and responsive to the needs of the patients and clients you work with, and brings you into contact with researchers and educators who can help you do that. And we're also really keen that you increase your knowledge and increase your ability to translate that knowledge into supporting really good, high quality, accessible rehabilitation services that are equitable for all New Zealanders. Some time ago, we did a graduate feedback survey, actually as a piece of research, and this is what our graduates from the program tell us they get from studying with us. They say that studying with us has definitely influenced their practice. They feel more confident to practice, and they communicate more effectively with their patients, with their clients, and with their teammates. They feel that they get enhanced credibility within the rehabilitation field, and they get a widened view and perspective of rehabilitation. Some of the other benefits they talk about in studying with us is that they feel that they have enhanced collaborative ability. And this is particularly interprofessionally. So it's not just within their own profession or their own unregulated workforce, but actually really widely across professions. That some people feel that they've got direct career or workplace benefits, they've had an increase in salary, they've had a promotion, they may have gone on to be involved in getting projects going in their workplace, or they may have taken on a leadership role. And 50% of our graduates say they've implemented service changes. So what qualifications can you do with us in rehabilitation? Well, the first thing is it's organised so you can take it step by step. Most people start with a postgraduate certificate in rehabilitation, and this is a 60-point award. Some people choose then to go on to complete a postgraduate diploma in rehabilitation. They carry through their postgraduate certificate and they add another 60 points to achieve the postgraduate diploma. Now, some people choose to go on and do the research degree, which is the Master of Health Sciences endorsed in rehabilitation. They bring forward the 120 points from their postgraduate diploma in rehabilitation, and they add another 120 to achieve the master's degree. Some people, fewer of course, go on to do a PhD, and we're very keen to supervise PhDs in our unit and supervise quite a number from a wide range of professions, doing a wide range of topics and using a wide range of methodologies. So if you start with the postgraduate certificate in rehabilitation, what can you expect? Well, what you can expect is a really good grounding in the core principles of rehabilitation. And this is covered in our paper called REHB701 Rehabilitation Principles. And then what you do is you add a special interest paper. And we have a wide range of these. They cover musculoskeletal rehabilitation, neurological rehabilitation, vocational rehabilitation. They cover rehabilitation with the elderly, or specifically with children. Or you might be working, for example, in an area of rehabilitation where there's quite a lot of overlap between mental health and physical health. And there, the paper called Personal and Psychological Factors in Rehabilitation is one that many of our students choose because they find it suits that very well. We have another paper that deals with service innovation and delivery and includes a clinical audit. And this is the paper that has led many people to make service or to implement service changes that they've found have made a difference to the quality and the equity of healthcare that they offer. And finally, we have a paper on interprofessional teamwork. And of course, this reflects the fact that the whole of your study with RTRU is based around this idea of collaborative practice and particularly interprofessional practice. So if you're going on to do your postgraduate diploma in rehabilitation, what can you expect from that? Well, what happens here typically is you add more papers, and this challenges your thinking and adds skills, because you might be moving just a little bit outside your comfort zone. Now you'll see here that the list of papers is exactly the same as the list that I gave you before, with the addition of research methods. Now the reason I've added research methods here is if you think that you might want to go on and do a master's degree at any point, then we strongly recommend that you include a research methods paper in your postgraduate diploma in rehabilitation, because a research methods paper is a requirement of the master's program. And so this sets you up for seamless progression between the postgraduate diploma and the master's degree. So what if you have a burning question that's arisen from your study through to the end of your postgraduate diploma in rehabilitation? Well, one of your options is to research it. And so there are two options here in the master's program. One is that you can choose the thesis option. And if you do this, then what happens is you do a 1 year full-time, or more commonly for our students, 2 years part-time original piece of research under the supervision of 2 expert supervisors. And all you have to do is discuss with us what your topic is, what your research question is, what that burning question is, and then we try and help you scope that research so that it's achievable within this time frame. The other option is that you do a 1 semester full-time or a 2 semester part-time dissertation. So the dissertation is a smaller bit of research, it's still original research, and it's still done under the supervision of 2 expert supervisors. Now, one of the reasons some people prefer this option is it enables them to do another 60 points of what we call approved papers. And you can choose very widely for these. You can choose papers from public health, from bioethics, from some other form of pain medicine or pain management, for example, or perhaps you have a particular interest in healthy lifestyles or obesity management or something like that. So there's a very wide range of papers in the health sciences suite of papers that you can choose from for that. So how does all this work if you study with us? Well, we're a distance learning unit and we've got 25 years of experience of doing this. So we were doing it long before COVID-19 meant that people had to move their forms of learning online. We have 2 main methods of delivery. We use an online learning platform that we call Moodle, and we use a lot of video conferencing. We also practice the principle we call flip, which means that in your own time, you actually do things like readings or preparation, whereas in the synchronous time, the time you spend online with others is discussion-based time. So you get the most out of talking with others with whom you are studying and with the staff. The other advantage, of course, of being enrolled with the University of Otago is you can have full access to the wide range of University of Otago resources that support you. So we have disability information and support, we have library support, we have student learning advisors. We have a whole range of supports that wrap round in order to make your learning experience the best it can possibly be. So in summary, we invite you to join a community, to learn from national and international leaders in rehabilitation, to study when and where it suits you, to work with distance learning experts who know how to help this method of learning work for you, to work step by step to achieve your learning goals, and actually in the end help you stand out from the crowd by having expanded your horizons and your skill set, and to make use of that unparalleled resource and support from the University of Otago. So we look forward to welcoming you to our learning community, and we encourage you to email us to discuss this further. Kia ora tātou.